So let me tell you a little bit about Drew that's going to speak here today on Zoom. Drew Yeannakis is a disability claims representative that has been assisting people applying for Social Security, disability, Medicare, and other community resources for years. Drew started work with one of our care service managers in the DC, Virginia, Maryland area over 5 years ago. Lucky for us, she introduced Drew to the care services team in Florida, and he has been assisting people living with ALS in Florida for a little over 2 years. Drew is so busy, he was unable to make the trip in person, but we're happy to bring him in here virtually. Charlene Carroll, our care services manager in Southwest Florida, will be facilitating this program to ensure that Drew is able to answer your questions when he is done. Thank you. Charlene, Drew.
Oh, first I want to say, Anne, you did great. You're a rock star. I so appreciate all your thoughts and compassion for everybody there. You did great. I'm Drew. I'm with Disability Claims Representatives, and I've been assisting people with disability now for a little under 27 years. It is a very complex journey. I'm going to use the same word we always use with ALS. It's a journey going through Social Security because there is a lot of information that is out there that is not necessarily inaccurate, but it needs to be clarified. And it is a complex procedure to go through. The first point I want to make is eligibility. With ALS in 2021, I think it was 2021, Congress waived the 5-month waiting period and gave Medicare immediately upon approval of your ALS diagnosis or disability. The one thing to keep in mind with eligibility is before they even look at ALS, you have to have met certain government requirements. And the biggest one is you have to have worked 5 out of the last 10 years. If you have not worked 5 out of the last 10 years, you will not be eligible for disability, possibly eligible for supplemental security income, but that's something we could talk about if you are not eligible for disability. The eligibility for Title II, which is the SSDI program, is very simple for ALS folks. However, the guidelines are all very new, and we've got a lot of brand new people at Social Security, so errors are being made, and it's very good to have an advocate that can help make sure that errors do not occur when you do your application. It is a compassionate allowance, but a compassionate allowance means it's fast-tracked. It doesn't mean you get a rubber stamp just because you have ALS. There's a lot of criteria that goes into making the decision, including an EMG and a definitive diagnosis of ALS. The providers are learning that we need to have the word definitive put in the medical records, because without it, the case will still be approved, but you might not get the waiver of the 5-month waiting period in Medicare. One other thing to also keep in mind with Medicare is you do not need to apply for it. Medicare automatically begins on the first day that you're eligible for Social Security disability. The application process is really mainly for folks that are turning 65 that want to go on Medicare that are not disabled. The Medicare concept is not as great as commercial insurance. One thing to keep in mind with Medicare Part A and B only pay 80%, and there is no yearly out-of-pocket. But back to the disability situation, we want to make sure that if you are applying on your own, you keep a couple things in mind. If you do not have a decision within 2 or 3 weeks, something is going wrong. It could be that the computer did not pick up the diagnosis. There could be a multitude of problems that occur. Since I've started working with Charlene in Cape Coral, we have had tremendous amount of people that have had their disability applications misapproved. And by having a misapproval, that means that you could possibly work or need to have somebody work on your case for over a year just to get your Medicare put into effect. Medicare is actually automatic once you are approved with the waiver, but if not, it's a 2-year waiting period. And this is something that is occurring a lot all over the country where just having a diagnosis code missed on an application, your case could be approved and gone into payment without the waiver. Unfortunately, the waiver cannot be easily corrected, and it has taken me sometimes between 9 and 12 months to get the payment center to fix it. Of course, everything is retroactive, but most vendors will not accept, we'll have it eventually, and hopefully we can get your equipment and stuff like that and medications through other sources while we're waiting, but it's not easy. I just want to see if there's anybody in the audience that has questions. I'm happy to keep going into different parts of disability, but if anybody has any questions, I'd like to answer them directly. And while you're all possibly thinking, I'm going to keep on going, but
Drew,
raise your hand.
Drew, we have one question. We have one question.
Okay.
Hi, Drew. This is Liz over at Nova. How are you? Thank you for all the work
Hi,
you do.
good, Liz.
Drew, my question is this. With the automatic qualification for Medicare, a challenge I see when people receive their approval is locating the Medicare number, especially needed to start getting equipment underway. I see a delay in the cards coming, and they have a hard time getting a hold of their policy number. And I've tried to direct them to Medicare.gov, and they find themselves going back and forth between Social Security and Medicare. And so my question is, what is the fast track to get that policy number once Medicare is approved?
Okay. When they receive their notice of award, which could be 2 to 3 weeks after they are approved for disability, the Medicare number should be written on the notice of award. You can access the notice of award going into the My Social Security account. And once you're in the My Social Security account website, there is a place at the very top, maybe an inch down from the top, where you can receive letters that Social Security has sent out. Your notice of award should be there. One other thing is Social Security will not give out the Medicare number. They changed the ruling and not using Social Security numbers anymore in order to protect people from Medicare fraud. One other way that a vendor or a hospital can access your Medicare number is to go into the Medicare system and type in your Social Security number. When people are first approved with Medicare, if they do not have commercial insurance as a secondary or as a primary, we need to get prescription coverage. And that goes into a whole nother conversation, but any provider of an Advantage plan or a Part D plan, D like David is for prescriptions only, can access your Medicare number through your Social Security number.
Any other questions? Drew, I think you could go on.
Okay. The time frame is very important with the ALS decision. If you are going more than 3.5 weeks, unfortunately, you're not capable of getting into disability determination. Most of the time, the analyst will not talk to you. Contacting your local office is what you want to do to find out why the case is taking so long. If you do not have an advocate working with you, ask the person at Social Security in your local field office, not the national toll-free number, but in your local field office, ask them to look at your case and make sure that your case has been flagged ALS. If it's flagged motor neuron disease, if it's flagged PLS, if it's flagged anything other than amyotrophic lateral sclerosis, it's not going to fast track. If it doesn't fast track, then you will need an advocate because we're going to have to go in and push the card in order to get your case moved from the backlog to an examiner for an immediate attention. Right now, unfortunately, due to staffing reduction, people retiring, and people just unfortunately leaving Social Security, the backlog is right now between 200 and 230 days. If you are applying on your own and somebody at Social Security tells you that, that is the standard line. They are required to say it exactly that way. And there are people at Social Security who do not know the difference in the laws pertaining to folks with ALS and non-ALS. Anyone with an ALS diagnosis should not be included in that group of people that are taking 200 days. The cases are flagged by the computer and normally are sent to an analyst within the next 2 or 3 days once you've made application. If you hear nothing from Social Security, from disability determination services within the first couple weeks, something's going wrong. Feel free to give me a call. I'll be happy to intervene and see if we can get things rolling. I know in all of the field offices on the entire East Coast that I'm working with, mainly with ALS and cancer patients, the backlog is so large right now that nobody is really looking at what is in the backlog to determine if it should be there or not. One other thing that you also need to keep in mind is a lot of people will go to their doctor and say, I need a letter. You do not need a letter from a doctor. Disability Determination Services only makes their decisions based on the medical evidence. For folks with a definitive diagnosis of ALS, a copy of the EMG and a clinic note from your neurologist stating that the EMG does confirm ALS, that's basically all we need in order to get your case approved. Fortunately, we have a lot of new folks at disability determination that are still learning, and some of them will still try to develop the case as if it was not ALS. If that is the case, I can get in there very quickly and stop them from doing it and get a supervisor involved to be able to push the case through. Time is of the essence with all of our ALS cases because a lot of our equipment, medications, etc., are dependent on Medicare. Our private insurance companies are doing a fairly good job about providing certain types of equipment, but a lot of times Medicare is the one that comes through. In dealing with Medicare very quickly, keep in mind that Medicare A and B are only for the hospitals and physicians, and that's all that Medicare right now is providing automatically. And your premium for Part B is $140, $174.70 per month. That just pays the physicians. Your Part D plan, which is only for prescriptions, is basically the same as an Advantage plan in terms of cost of medication, etc. However, your Part D plan has a premium charge. The Advantage plan has many advantages. That's a Part C, like Charlie. The Advantage plan has one major advantage is it does have a yearly out-of-pocket maximum, where Medicare does not. Medicare, you're going to be paying 20% across the board, January through December. Your Advantage plan is like a commercial insurance plan where it does have a maximum out-of-pocket. The other advantage of an Advantage plan is it also gives you eye, hearing, and dental allowances. Unfortunately, it's almost the same as going with a commercial plan. It doesn't pay for everything, but it does pay a good portion of it. You do not have those services with regular Medicare. Keep in mind, though, with Medicare Part C, most hospitals do not take all of the different commercial insurance companies that are facilitating your Advantage plan. I have a colleague at eHealth that's been very instrumental in helping our ALS folks, especially down in Florida, get the best possible Advantage plan that covers more than just one hospital or one provider, so that you are in network and not have to pay an out-of-network premium. With your Advantage plan, having a PPO will allow you to go anywhere that accepts insurance. An HMO is more limited, and you're limited to a certain group of hospitals and certain group of doctors. With, with onset of symptoms is something that is very important when you're looking at Social Security disability. There are lots of policies and procedures that have allowed us to move or write off people's work, taking them back almost a year possibly, because the symptoms for ALS take a while to show up deep enough that you can get a diagnosis. It's a very lengthy process to write somebody's work off. I do it all the time. I find that most of the Social Security offices do not attempt to do it because it's time consuming and they don't have the ability to take the time to actually do it. It takes a lot of documentation to be able to write off somebody's work. We do it all the time because that could also give you retroactive Medicare back to the maximum of 1 year from date of application. So I'll break again right now and ask Charlene if there's any other questions that are out there.
I don't see any other questions.
Okay. One other thing is making application. Keep in mind, if you are still working, you are not eligible to apply, even though you are disabled with ALS. If you are still working, you are not able to go and apply for Medicare unless you're 65. So making the decision to stop working is a very personal one. It's one that we can discuss financially. Most people that are attempting to continue to work find the quality of life better because they are still working. There are also provisions to be able to work very part-time and make a flat amount of money per month while you are on disability if you need to supplement your income or if you want to continue working. One other major factor in dealing with leaving work is you never want to quit your job for any reason if you have short-term and long-term disability. If you quit your job, you could lose your ongoing benefits. Short-term and long-term disability are very important because they pay a whole lot more than Social Security disability. Short-term and long-term disability normally pay 60%. And even though the short-term, you'll be double dipping in most situations because they're going to pay you on top of your Social Security benefits during that first 6-month period. However, once you go on long-term disability, your maximum benefit per month is whatever your long-term disability company is paying. So if it's 60%, that's how much you're going to get. Social Security will be deducted from your long-term disability plan. So if your long-term disability is $3,000 and your Social Security is $2,000, you're going to get $2,000 from Social Security and $1,000 from your long-term disability company. Your long-term disability company also can review whenever they want. Where with Social Security disability with an ALS diagnosis, you most likely will never see a review. And if a review does come out, it would be suspended because they don't review people with ALS. The computer generates the request to do a review. If you do get anything in the mail concerning a function report or a third-party function report or a work history report, normally these are sent out by the computer and they are not necessary for an ALS case. So before you spend time filling out, it's almost 20 pages that you would need to fill out on a regular disability case. call and make sure that they do not need it, because it's just a whole lot of information that is not necessary for you to have to write out. Like I said at the beginning, it's a complicated, very difficult procedure to go through to apply for government benefits. One of the big problems that we have is people who are bulbar are not able to identify themselves to Social Security to be able to talk to Social Security over the phone. An appointed representative or an appointed attorney representative would have the ability to override that and speak to Social Security on your behalf. Your loved ones and your family members will be turned away by the telephone because they do not have the right legally to talk to you. Charlene, did I see a hand go up?
Hello? Perfect.
Okay, now I can hear you.
Hi there.
Hi.
I've spoken with a local advocate for Medicare or whatever, and I had we ran into a something with drug costs, which I don't know if others have run into, and that is that none of the Advantage plans or Part D were paying for Radicava specifically.
Correct.
And wondering if that changes in 2025 or if we took the right path by going to very expensive Cobra, which is what I have as my secondary.
That's a tough question. We do not have a definitive answer yet from the government about Radicava. The one thing I can say is that through the pharmaceutical company, you might be able to get some copay assistance because you are on Medicare. The other option is we have the HealthWell Foundation that also helps with copays. And you can get the number for HealthWell Foundation through your care coordinator at your local ALS association. But I do know that there are some people who are getting financial help through Medicare for Radicava, going through a drug program through their pharmaceutical company. Also, we're lobbying, and I don't know how long this is going to take, but we're lobbying to get Radicava put into the formularies for commercial insurance as well as the Advantage plan. A lot of our commercial insurance companies already cover Radicava under a group plan or a business plan. That's why you can use Cobra. Cobra is very, very expensive, but so is Radicava. We're trying to get the same companies that are offering the Radicava through a commercial plan to also do it through their Advantage plans. But one thing that I did find out this year, which is a reason why none of the formularies are coming out yet, is a lot of our Advantage plans that are PPO are being discontinued. For instance, the Anthem PPO plan for Advantage plan, which I have, is being discontinued at the end of the year. Luckily, I can go HMO because everything is all in one place. With a lot of folks with ALS, you're going to different hospitals and different clinics and different situations. So HMOs are a little bit more difficult, but because of the rising cost of healthcare and the losses that insurance companies are taking, both with healthcare and with homeowners and auto, they're cutting back a lot of programs. We're seeing a lot of different things happening within Medicaid through the different state agencies where certain things are no longer being provided. Going on Cobra is a quick fix. Depending on your income level, you still might be able to get the pharmaceutical company to help, and then along with HealthWell. But long-term, Cobra is extremely expensive, and you might want to start when open enrollment begins. I think it's week after next. You might want to call around to the different Advantage plans and see if any of them are starting to pick up Radicava. I do not believe it's going to happen this year.
Thank you, Drew.
And I think we probably are getting close to out of time. If there's any other questions, I'd be happy to answer them. My phone number's on the screen. Anybody can please feel free to call me at any time. I'm very busy, but if you leave your name and number, I will call you back. Any advice, any information I can give is 100% free. And anything that I can do to help you with your journey, please feel free to call.
Drew, thank you so much.
You're welcome.